And the big question on everybody's minds is, by kind of measures to stop this winter, are we talking about lockdowns? Are we talking about curfews? Are we talking about those kinds of mitigation efforts? Or are we able to cope with this pandemic and keep the economy open this time around?
Well, first of all, we just have to understand that the term lockdown means a lot of things to different people. And what we're really talking about is how are we going to respond when these case numbers continue to increase so substantially, and what will that mean? Also, what does just an uncontrolled pandemic do to the economy in by itself, even if you don't do anything in terms of official government action? I think the important message here is as Meg just laid out, we are seeing this very rapid increase in cases. Remember, at Labor Day, we were at 32,000 cases a day. Today, we're at 120,000 cases a day. And my prediction is that that number is going to go much higher than 120,000 each day. Hospitalizations are going to continue to increase substantially. We will see many healthcare systems in many states completely overrun in the next 3 to 14, 15 weeks. And finally, the other piece about this that isn't being talked about is the fact that we've identified 40 drugs right now that are really key to treating patients who have COVID-19. Not the kind of drugs you think of in terms of Regeneron or anything like that. But what do you take to actually have to intubate somebody? What do you have to do to treat a bacterial infection that they get from being in the ICU? And of those 40 drugs, 29 right now are in shortage status. And with European countries also wanting those drugs, largely coming from China, we're going to see real decreases in quality of care over the course of the next few months as we run out of those drugs too. So this is not a good picture at all.
No, and I mean, based on what you're saying, you would think that, you know, we should do whatever you want to call it, shutdowns, you know, stay-at-home measures, you know, today, nationwide. What would you advocate? I mean, how then do we go about trying to keep this disease from spreading so quickly?
Yeah, I would agree with you 100%. But let me add context to this, because so many people have equated lockdowns as some kind of restriction on their personal freedom or financial ruin. And I understand particularly the latter one. And in the first week of August, Neil Kashkari, the president of the Minneapolis Federal Reserve Bank, and I wrote an op-ed piece in the New York Times predicting that what's happening right now was going to happen. And the only way that we're going to do anything other than this was to basically, just what you said, lock down society to the point of where we limit transmission, stay at home, don't have people out in public places, close bars and restaurants. But because the savings rate had increased so substantially during the pandemic and interest rates being so low, we could borrow that money from ourselves and begin to cover the cost of this, which in itself financially would be the way to really invest in our future. If we look at the Asian countries right now, they've done that, and they've done it very well. Look at what's happening over there. The virus is under control, their economies are booming, and they're not having people die. And so I think we could take a page out of that, use what we had recommended in the August op-ed piece, and actually make a big difference. My concern is I just don't see any political appetite for that, doing that.
Shepard Smith here. Thanks for watching CNBC on YouTube.